Thank you for coming to this afternoon's session on beef herd health management. My name is Mark Hilton. I'm a technical services veterinarian for Elanco Animal Health in Indiana. And we're pleased to have as our keynote speaker this afternoon, Dr. George Caldow. And George is works with the Scottish Agricultural College of Veterinary Services and consults with farm animal veterinarians in Scotland, and has had long-standing work in the area of beef production medicine. And he is responsible for the Scottish Government's Health Planning Institute initiative, and his topic today is herd health planning of the beef cow herd. Please welcome Dr. Caldow.
Thanks very much, and thanks very much to the organising committee for the invitation to come to Dublin to give this presentation. We've been talking about health planning and preventive medicine for decades, and it's a discipline which is used in all the other production systems to a high degree. It embodies the analysis of production data and should encompass risk management, and it allows the veterinarian to have a pivotal role in the support of efficient food production. And in addition to that, it safeguards animal welfare. And in those industries which are pushing hard to gain every little bit of improvement in efficiency, the vets have been invited into the advisory system to a high degree to work with nutritionists and animal production specialists. So it's well developed in those areas, but it's fairly poorly developed in the beef cow sector. I'm not going to review what the initiatives are throughout the world. It's difficult to get to that information because of the nature of the work that's done. But what I want to do is to outline what the problems are in the beef cow sector and suggest ways that we can perhaps work to overcome these problems and to improve production efficiency. And the beef cow production is important throughout the world, so most of the focus of these meetings is on dairy cows, but a lot of us still do a lot of work in beef cows. From the temperate grasslands in Western Europe and North America to the tropical grasslands in throughout the world, there is beef production. But what's also true about this, that it's a really inefficient system. There's a higher demand for maintenance per kilogram of output. This is because of the demands of the parent herd, but it's also related to the long period from birth to slaughter. And in most of the analysis of these industries, it's rarely profitable without the help of direct payments to producers. And this is output from our New Zealand grassland management module, and it's published in the work by Morrison Smeaton. And what we've got here is the average performance beef cow herd, which is 82 calves per 100 cows with a fairly modest growth rate of 0.8 kilos per day. Compare that to the high performance in the New Zealand situation, which is 92, and you've got 1.4 times more output on the same pasture type. But if you look at that in relation to the high fertility ewe flock on that same pasture type, we get 1.7 times the output from the poorly efficient performance beef herd. And the final thing would be in one-year bull system, where they can get almost 2.6 times the output. So we're seeing a fairly inefficient system, and clearly the one-year bull system, they are orphans from the parent herd, the dairy bull calves from the dairy herd. But this underlines one of the problems that we face. And we've also got the issue that fixed costs impact significantly on the profitability. And in Western Europe and in the British Isles, short grazing seasons accompanied by high rainfall in the winter means that the breeding herd has to be housed, so there are costs of housing. In addition, the cost of labour can only be reduced to a certain degree. Beyond that, then the profitability of the herd will go down as well. So despite these the impact of these fixed costs and the difficulty in controlling them, the relative probability is closely related to the physical output. And the physical output is too low. In Great Britain, using the source from the Levy Board's data collection system, the average weaning percent is 87%. In New Zealand, it's quoted at 82%. And the ICBF database in Ireland, which is extremely current, has a figure of 82%. Now, it's quite probable that the UK figures are actually at the 82% too, because they're representing people who are going out their way to record that 87%, and the average is almost certainly going to be much lower. So I think it would be reasonable to be looking at an average of 82% in those situations. Now, the thresholds for profitability are considerably higher than that. A review by the Meat and Livestock Commission in UK gave it at 94%. In New Zealand, it's accepted to be greater than 92%. So you have to question, really, is there much of a role for such an inefficient system when we can do other things with the land use? But it's quite important to realise that there's not much can produce meat or produce agricultural output from some of the land that we're talking about. So in the picture there, you'll see a cow and calf in upland hill pastures in northern Britain. And you can see that a fairly large calf is produced from that. The other thing to remember is that there has a complementary role in more efficient production systems. So in New Zealand and in Scotland, the beef cows fit in with the more profitable sheep production systems. So it allows better pasture management and it allows better parasite control. It also has a role in arable systems where the cows can use the byproducts from various arable systems for their energy source. And one important thing when we're considering beef cow production is, and livestock production in general, is the impact that it has on greenhouse gas emissions. And livestock production clearly is a significant contributor. And the proportional output of methane is higher when poor quality forage is used. Now we know that there's a large within-breed variation in food conversion and greenhouse gas emission, and in the longer term there will be the ability to select more efficient animals. But certainly, as long as we have output figures that I've just presented, the only way that we can really mitigate the greenhouse gas emissions is to improve production efficiency. So by improving production efficiency, not only will we increase the gross margins of our clients, we will reduce the greenhouse gas emissions per kilogram of meat produced. So both of those two goals are really important. And if we think about improving efficiency of beef cow herds, what is the measure of that efficiency? So the output is the weight of calf weaned per kilogram of cow mated. And the target is 0.5 kilograms per kilogram per year. And what you're looking at there is a calf which is growing in excess of a kilogram a day, which is required from a very fertile cow. So what do we need to do that? We need cow herd to have good fertility, to produce first calf at 2 years of age in all but the most challenging situations. It should produce a calf for 9 years, use forage efficiently, and be able to store excess energies to be used at times when there is no forage available or certainly reduced. And what we need from our calves is that they have to survive birth, they have to resist the diseases of calfhood, and they have to grow to exceed 1 kilogram per day on milk and forage. So that's what's required to reach those targets. And the questions that we have to ask is, do we actually know enough about the limiting factors for reproduction and calf survival? And if we do know enough, can these factors be managed to promote efficient production? So postpartum anestrus is 2 weeks longer in suckled cows compared to milked cows. So you've got a barrier straight away to overcome. But the principles of managing the cow's energy status have been established for a long time for growth and reproduction. So that's been known, and we know how to manipulate that. We know how to manage cows' body reserves through the use of body condition scoring. This was developed in the 80s in the States with a 10-point system and the 5-point system in Great Britain, which is essentially the same, just different points on that same scale. So we have tools to allow us to manage the nutrition of these cows. And there have been enough work done on assessing reproductive capacity of bulls to ensure that this information can be used very effectively to weed out the animals which are less fertile and prevent bull infertility being a problem in these herds, or certainly reducing the frequency with which it occurs. So there's been sufficient work done to establish that the reproductive limitations aren't a barrier to achieving the level of calf output that's required. And in terms of the calf survival, dystocia and calf mortality is the second most important area of loss. And managing the cow condition again to minimise dystocia and ensure good colostrum production is key in this area. And there's been enough work done on the genetics and using estimated breeding values for calving ease, gestation length, and maternal traits to provide tools that are really effective in terms of reducing dystocia and promoting calf survival. So when you put that all together, and we've done that within the UK situation, you come up with a 5-point plan to manage beef cow fertility. We have heifer management to ensure early breeding and target growth rates. Straightforward targets are known for this for beef heifers as there is for dairy heifers. We have good tools for bulls soundness examinations, and they're now standard in many parts of the country. And we can manage the cow condition and nutrition using the target condition scores to avoid excessive weight loss and excessive fatness at calving. We can use EBVs as well to manage that. So this 5-point plan underpins what we've been trying to do in Britain to improve the fertility of the cows and their survival. And added to that, we have various initiatives to control infectious disease and to promote biosecurity in these herds. So the first question I asked was, do we know enough about the limiting factors for reproduction and calf survival and growth? And I think the answer to that has to be yes. We do know more than enough on that area. The next question is a little bit more difficult to answer. Can these factors be managed to promote efficient production? Well, I would say that they can in most situations and in most years to certainly improve the level of production way beyond the average, and in most situations to reach the targets that have been put in 92 or 94 calves, depending on which country you're in. So I think we know what we need to do, and the question then is health planning the tool to allow us to do that? And health planning is a framework for the delivery of veterinary expertise. And the target with this is to make the best use of the resource available for the benefit of the producers and also the animals. So I think that it's clear to me that with the long-term cycle of beef cow production, that a strategic approach to managing these risk factors through health planning is the best way to achieve that. And if you speak about herd health planning to farmers, they will not understand what the difference between herd health planning or herd health plans or health schemes are. So these terms tend to be used interchangeably, and yet they are very different. And we've had herd health plans in the UK for many years, and they are now embedded in the farm assurance system. So what they were and what they continue to be is a formal document that detail the diseases present in the herds and the required treatments and preventive actions. And the farm assurance have adopted this as a good idea to the extent that it's a a requirement for all our farm assurance systems that they have a health plan in place. And without this, they will not get access to certain markets with their products. And the focus on this is very much on the written detail and has never been on the analysis of production data, and it's never been on the analysis of disease occurrence. So the consequence of that is that we end up with the production of a document that's the end in itself. Once it's produced, it's no longer referred to and lies dormant until the next time that it needs to be taken out and signed and dated. So it doesn't achieve very much at all. And the advantages of this is that it can be generic. We can have a health plan for beef cow herds or sheep flocks or whatever. And it can be useful to produce a calendar of events for timing of vaccination, anthelmintics, etc. And you can include standard operating procedures within that in terms of disbudding or castration or bull examinations or whatever. And undoubtedly it can suit simple systems. So you can understand the attraction in it to many people. The disadvantages of it are that it lacks the concept of review and analysis and improvement. So there's no veterinary expertise being brought to bear to allow continuous improvement. And therefore, the veterinarian can have minimal impact on improving the profitability of the enterprise. And ultimately, as we found out in the UK, it doesn't actually need veterinary expertise. And many of these health plans are actually drawn up by people who are not vets and delivered to the farmer. And for some reason, that satisfies the assurance system. So the challenge that we thought when we were looking at this was to move it from a static document situation into a dynamic process and allow the collection and analysis of the data to identify areas for improvement. And one of the problems that we have is that, in contrast to many of the other industries that we're involved in, there is inadequate data collection within the industry, and it's difficult to overcome that issue. So we needed to create standard methodology for the data collection and analysis. And that takes us away from the farm health plan to the concept of farm health planning. And the advantages in this are that it is a dynamic process, that it's farm enterprise specific, it's relevant to the enterprise objectives. So we want to know what the individual farmer is trying to do, what his short and long-term objectives are for the herd. And it's a structured approach to recording and interpreting the information. It integrates strategic planning with operations management and internal control. So these are systems that need to be managed. They're systems that need to be thought about. They're systems that need to be planned. And the role of the vet in all of that could be extremely important if that was allowed. The disadvantages of it are that it really requires effort. So where the information is not automatically recorded, as occurs in the modern dairy herd, the staff have to record that information, and quite often they're recording the information on several occasions to aggregate it. And it requires, in theory, expert vet input. But these systems are relatively simple and straightforward, and it should be possible to ensure that anybody working in beef and sheep practices can provide that supposedly expert veterinary input. It requires discipline from all for the process to continue. So these data must be collected all the time, entered all the time. They must be reviewed by the vet regularly. There must be conversations between the vet and the farmer regularly. And for all that effort, it must obviously confer real benefits to the business, or it won't continue. So if we look at the data collection side of it and try and understand the barriers that might exist in that situation, within the EU, we're legally required in the beef cow herd to record the number of animals on the farm, their age and identity. So that is present in all the herds within the EU. We have to register births within 27 days, so the calves must be tagged and then they must be registered within that database. And we have to register deaths and movements as they occur. What we don't have recorded in that system is the number of females mated. And we don't record the number of calves that died before they're registered. And in this system, most of the calf deaths are occurring before the 27 days. So most mortality is within the first week of life, with some going on beyond that. And there are very occasional deaths subsequent to that. So we're missing two key pieces of information that are not recorded. And then if we think about what the key performance indicators should be in these beef herds, we have the percentage of cows that calve. And that is not available unless the calf is recorded, tagged, survives. Percentage of calves that born, and the percentage of calves that die. And only the last one, which I think is really important in terms of measuring reproductive efficiency, is the percentage of cows that calve in the first 3 weeks you can actually get from the information which is recorded within the movement systems that are used in the EU. So what we put together was a web-based recording system where the farmer records all the data that we require. So that's back to determining what his bulling groups are. It's back to recording every reproductive incident. Has the cow calved? Did the calf survive? How many calves were born into that situation? And from that, we can then derive our key performance indicators with ease. So the concept very much is that health planning can be very time-consuming, and the veterinary time in particular is expensive, so the farmer should record these events. So the farmer records the key events. It's also important that they detail what they currently do, and list any disease thought to be present. And the next step in the health planning process is for the veterinarian to be involved. And they should analyse the production figures, so get a view as to where they are in relation to where they should be. Review the existing health protocol, what the farmer's doing, what products are being used, and identify and assess the risks to the system. These risks could be disease risks, they could be related to reproduction, they could be related to nutritional management, but it's essential for the vet to identify and assess those risks. And then the final part is advising on the mitigating actions, which would be agreed in conjunction with the farmer. Now, the collection of data is one aspect of health planning. But a really important part of health planning is risk management. And the HACCP system has been used in the dairy herd to deliver veterinary advice at the areas that it needs to be. And HACCP works well. Well, all of these systems are basically taken from engineering processes. So the processes have a start and an end. We know what the inputs are. We know how we want to control them. In HACCP, this has been adopted by the food producing sector to a high degree, and that would be a logical position for the dairy herd to go down, as has been argued previously. But what we would say about that HACCP in comparison with the standard risk analysis approach is that risk analysis also embodies the prioritization of risks and allows the scarce resources that are available in many of these beef units to be prioritised. So I think that if we're thinking about the best system that's available for health planning in the beef cow, we can perhaps combine both of these approaches, but the risk analysis one is the one that takes most priority. So we get effective prioritisation and we achieve the greatest gain in a production system And as I said before, this is where the financial resource is likely to be severely limited, and you have to take careful decisions about what the correct actions are. And of course, within this, there are the need to have monitoring to show that you're actually achieving what you've set out to do, and you need to be aware of what actions should be taken if monitoring indicates inadequacy. Now, many of these things are more or less intuitive to the veterinary surgeon that's dealing with preventive medicine, but it has to be thought about carefully, and the concept of risk management has to be communicated clearly to the farmer. And one of the things that we've found in our dealings with farmers is that in many ways the farmers are more amenable to the concept of risk management. That's the environment they're working with on a daily basis than the veterinary surgeons are. But communication is key in the understanding and the communication to the farmer about the importance of the risk management approach. And one other thing which I think is of vital importance is the better use of animal health products. We're in a situation now where there's a large focus on residues, on the use of anthelmintics, on the use of antibiotics. There is concern over the administration of unnecessary mineral supplements. And in many of the herds that we deal with, the actual knowledge of the input to the herd with these products is scanty. So the products are used without veterinary advice. They're often used inappropriately, unnecessarily, so that we have considerable potential for righting the incorrect use of anthelmintic and mineral supplements in most of our beef cow herds. But we need to know what they're doing before we can start down that route. So within the programme, the farmer has to detail the current use, and the veterinary surgeon would review and update and advise. And our experience in this area is that the cost savings can be considerable, and even it doesn't take much to exceed the professional fee for the health planning. So it's very easy to justify health planning from this aspect alone, the better use of animal health products to ensure the most effective, cost-effective use of these products, and to safeguard the product to the consumer. And this is a slide from an old presentation, and I want to show it for two aspects. If you look at the number, which is the second column at the bottom, there are 306 herds where we had full sets of data, 306 herds. In the Scottish situation, we currently have around, well, in excess of 2,000 herds that are cooperating in the paratuberculosis control programme. And it doesn't really matter how you look at paratuberculosis, but it's extremely unlikely that it's going to impact to the extent of the reproductive inefficiency and calf mortality problems that we see. And yet it's been remarkably easy to sell paratuberculosis control to farmers and very difficult to sell health planning to farmers. So we have to ask what that's all about. Why would that be? And if you look at the final column there, headed Q3, at the bottom you'll see that this is the third quartile. So what we've got is the third quartile point in the distribution of calves weaned is 93. So in this data set, we have 25% of the people that are recording data are exceeding the target. So it suggests to me that there are a lot of guys out there that do the job very well, and they may be doing the job because they're getting expert veterinary support, or they may just be lucky on those years. But we can always argue that the health planning will ensure them to continue to reach those targets by controlling the risks as they apply. So if we go back to that small number in relation to the overall number of herds that could participate in this approach, traditionally cattle farmers in Britain have been slow to adopt health management strategies that have been shown to improve profitability. And the best example I would give of that is the mastitis control. Despite the work, fairly basic, fairly effective 5-point control program for mastitis developed by NIRD in Reading, the mastitis improvement in udder health, improvement in milk quality went nowhere, despite us having the tools to allow this to be done. And mastitis control only really improved once there was payment penalties were introduced. So there seems to always to be a really slow uptake of systems within the cattle sector, at least, which are likely to prove dividends for them. And you would have to wonder why that is. In relation to health planning, are we in a situation where there's a high level of scepticism on the majority of farmers and veterinarians, indeed, and veterinarians, that change is possible and that health planning is the tool to help? Alternatively, it may not be down to that. It may actually just be too difficult for the modern beef cow herd, where resource is so limited, where labour is so restricted, that it's really very difficult to do anything about managing the risks to the production systems. So there are clearly barriers out there, and one of the things that we could do with this project was walk away from it. We've tried to convince farmers and vets that health planning is important, that it's the way to address the production shortfall, that it's possible to address the production shortfall, but the mechanism that we put forward doesn't work. So one approach is just to say, well, we tried, we failed, we can come up with something different another day. But I think it's important to consider probably what's the most important barrier in all of this, and it's the easy collection of data. And how can we overcome that? One of the problems is that they collect this data in several different ways to be used in several different systems. And this needs to be streamlined. So we need to be able to record these key, very simple things once and use it in multiple applications. So combine the statutory requirements, and you can see with the Irish ICBF system that that's been done extremely well, and to use the production data from that. In addition, we can tie up the statutory requirement for medicine control through this system as well. And the obvious tools for doing that is to record it once in handheld devices. And we're all able to use smartphones, and most farmers could not run their business now without the use of smartphones. So it makes sense to use the system that way. So we use handheld loggers, mobile phones, logging the herd and the medicine inventory, combining them to allow these actions to be recorded once. We can do the same with weigh crates. In a few years' time, we'll be able to use cheap temperature sensors to better manage the health of calves, which will be notified through these systems as well. So the technology is there. It's easy enough to develop, to bring forward, and that's our intention to do that, to ensure that the events that are important for managing the health are recorded once and used multiple times. So the data would be automatically uploaded from handheld systems and used in a web-based herd health planning system. And from that, we can derive our key performance indicators. So the advantages of this are we can use more efficient data more efficiently. But also the other important thing is that the data analysis moves into real time. So we can get immediate notification of events to the vet. We can identify clusters of deaths, assisted calving, so that you find out as they happen, as opposed to casual conversations several months after the event, or with the annual analysis of the data. So we get early contact and discussion with the attendant benefits to everybody involved, not least the welfare of the animals that are under our care. So, in conclusion, we can say that the produce from the beef cow herd is an important livestock output in many countries. And short of planting many of these areas with trees, I think it's going to remain an important livestock output in many countries. The profitability is low, stemming from the low levels of biological efficiency, but also because of the low level of productivity. 82% of calves weaned per 100 cows is too low. And we have sufficient understanding to manage the herds to achieve at least 94 calves reared per 100 cows mated on a regular, ongoing basis in the vast majority of these herds. And there's a powerful rationale for doing that to increase the returns to these producers that are severely pressed, but also to respond to the demands to reduce greenhouse gas emissions. And I would say that the vet is well placed to provide a service, best placed in my view, to provide a service to help achieve through those goals through health planning. And for health planning to be successful, the process has to embody data collection and analysis. We have to use the data efficiently, and we have to have risk management embedded in the systems. We have an opportunity also to review the use of animal health products in each herd and to make that, rationalise that to the extent that you save the farmers and reduce the chance of residues and resistance in anthelmintics in particular. And I think that by marrying fairly mundane technical advances that have been made in the recent years, we can allow the easy collection and aggregation of data on a web-based database to provide the tools that are required for these purposes. So that's the acknowledgements for this presentation. There's been a number of us involved in developing these systems over the years, and the list is at the bottom. The Scottish Government have funded it and continue to fund it. So thanks very much for your attention.
Dr. Caldow did a very nice job and left us time for questions, so please direct your questions to him at this time.
David Taylor, Scottish Borders.
Do you want the microphone there?
David Taylor, Scottish Borders. George, agree with the statement, the need for collection and aggregation of data, but how far down the line are we with the different organisations getting together to pool that information and data from government to various private agencies?
I think there's no barrier to it in most countries, unlikely to be a barrier to it in most countries, and there's no barrier in terms of the technology. It just needs the two bits to be linked, and I don't think there is any barrier to that either. And talking about time to do that, several months.
Hello, Andy Cant for Orkney. Two things. I wondered, you were saying about the sort of mastitis being improved when there was payments related to that. I was wondering if you had any information just on the Scottish Government's beef efficiency scheme, what uptake there's been with that as yet, or are we too soon to know? Because there's money being given for people to do various collecting.
The uptake's been reasonable. I think it represents about half the suckler cow herd in Scotland. And for those of you who are thinking, well, what's the beef efficiency system? It's largely modelled on the Irish initiative, looking at genetic improvement, measuring the genotype of the animals that are being slaughtered. We hope that will be running within the next 2 years.
My other thought was, again, you were saying that beef herd profitability is still reliant on direct payments, by which you'd be meaning subsidies, I presume. So I was wondering, you're trying to incentivise people to do these health planning things, and we have difficulty in getting folk to do that. So in a way, is the subsidies actually making people inefficient in that they're just sitting there not doing things because they feel that there's a buffer there? So if we got rid of subsidies, would that be an incentive in your mind?
I think it would be more than an incentive, but I suspect that in the Scottish situation and probably the British situation, it would end up in a real reduction in cow numbers very, very quickly. I don't think the New Zealand situation is a good example where the subsidy was removed at very short notice. And in that situation, they managed to survive. But they are in a much more favoured situation in terms of a length of grazing season and the need to house cows. So their fixed costs are much lower and their costs of production are much lower. So you can see how it would operate in a situation like that. But in the marginal areas, the Celtic fringes and further of Europe, I think it would be a disaster for the industry if that payment was removed.
Sorry, my name is James O'Shaughnessy. Just in relation to the figure for cows per calf produced per year, is there, I suppose, a ceiling depending on cow genotype, as in, you know, we'll say the figures of 0.94 quoted. What about it in Ireland where there's a lot of continental genetics used? How achievable a target would you think that would be?
Yeah, if you're talking about the makeup of the suckler cow herd and that it has too much continental terminal sire genetics in it, then I would agree. I think that it's difficult to reach those targets with that cow as your base cow. And I think there needs to be more movement towards the composite breeds and a step back to the more traditional breeds. So the ones that we have experience of would be stabilizers, lings, Galloways, blue greys, and these cows are inherently more fertile than the ones that have continental cross out the dairy herd. I think you will struggle. I think you're completely right in what you're suggesting.
Joe Brown, the UK. George, that was a really elegant talk. Thank you. You make a case for collecting data for the veterinarian and his farmer to get better performance. Are you making a case for collecting data across a region, not just between the vet and the farmer, but just what's going on in the region, and who would do that and who would benefit?
Yeah, well, I think it maybe glossed over that part, but one of the big things that you get out of this approach is it allows benchmarking. And I think that most of us here understand the power of groups in terms of getting messages over and improving performance and being allowed to develop our expertise as we interact with those groups. So that within the database, the performance of the herd is compared to whatever, the breed of the cow, the region, the practice setup. So you can set up your points for discussion on that basis. I would see it as particularly useful as a practice tool so that you could have benchmarking within the clients, the beef clients that you have in the practice.
Are there issues of confidentiality here?
There are always issues of confidentiality, but the way that these systems work is that nobody gets to see anybody else's data. They may get to see the group's data, but they don't get to see another individual's. Clearly, the consultant vet that's looking after those, they know all the data.
We have time for one more question. Thank you, Dr. Caldow.